talking about magnesium. Has lots of functions. Keeps the heart rhythm. The heart is susceptible to that. It supports a healthy immune system, keeps the bones strong, helps to regulate blood sugars, promotes normal blood pressure. Really not sure yet how well it does with hypertension and cardiovascular disease, but they're studying that. It does help somewhat with those things in diabetes. It's absorbed in the small intestines. It's excreted through the kidneys. So if our kidneys aren't working, magnesium level is going to be too high. All right. That's all I want you to know about that at this point. No fancy words for this either. So it is affected by diet as well. All right. So moving on. Diagnostics. X-rays. What is their purpose? X-rays help us penetrate tissues and organs. It depends on the tissue density and the organs, but it helps us to see. A plain X-ray, just like the skull, the abdomen, the chest, and bones, it's a one view of the patient's anatomy or whatever we're looking for. Tomography is three-dimensional. It's a cross-section. It can provide a bunch of different views and angles. And fluoroscopy is showing us, it views this, but it also shows them while they're moving. So it helps us see. It's not just a one snap in time. It's actually, we're x-raying them as the body or whatever that we're looking at is moving. So a cardiac catheterization is the type of fluoroscopy that on the screen we're watching as the scope is going through and looking. Upper GI is another example of it. It's higher exposure to radiation than a standard x-ray. I want you to look at these videos on your own and watch them. You'll make much more sense of what a fluoroscopy and all these other studies are as well. Here's a picture of a CT video. I want you to watch this also. It'll make you a much better nurse if you can describe to your patients if they're nervous or scared or anxious and they've never had these things, what's going to be done. So watch this video and it'll help you see that too. MRI, what's the difference between an MRI and a CT? An MRI is non-invasive as well. It uses a magnetic field. There is no exposure to radiation, unlike a CT. And a CT has more radiation than an X-ray. But MRI is no radiation. It's only a magnetic field. Typically, it's more expensive. It is more expensive. But it provides a little bit better picture between normal and pathologic tissue than even a CT. Watch the video so you know what you're going to be telling your patient about. Since it is magnetic, we want every part of any type of metal off our patient. We ask if they have something internal that's metal, they can't have an MRI typically. Maybe they have a metal plate from some type of head trauma or surgery or something. They may have metal pins from orthopedic surgery. They're typically not candidates for an MRI then. We don't want that popping out during the test. So at any rate, that's part of a nursing job, is to get the history to make sure there was no metal objects. They need to remove bobby pins, all that kind of stuff. An ultrasound, what is it? There's a video I want you to watch. If anybody has ever had a baby or seen a fetal ultrasound, there's all kinds of ultrasounds, not just on fetuses that we can do, although those are the most fun. We can look for clots in legs by ultrasounds. We can look at the gallbladder. That's the best test for that as an ultrasound. And it tells you there, determines the contents of what it is. Like sometimes if a woman has a lumpectomy or a lump, they will use an ultrasound to guide. The provider will use the ultrasound to help him or her guide exactly where they need to get in there in order to pull out some of the tissue to biopsy. Evaluates a pregnancy. We can do all these other things as well with it. So watch that video. A nuclear scan, what is it? Well, pharmaceuticals are given, which means medications are given, usually by IV. And the photons emitted from a particular organ or abnormality, it can be detected. It's used typically in conjunction with other diagnostic tests. It's usually not the only test, but watch that video and it'll help make more sense to you what it is. Okay. Endoscopy, what is it? We're going to look at the internal organs or internal structures using an endoscope. We can also get a biopsy of it. So at the very end of the endoscope, there's little tiny scissors that, let's say we did a biopsy of a lung, we can go in and then they will remove a little piece at the same time that they need to biopsy. They can do other things too besides biopsy. They can actually do prevention or surgical interventions while they're in there with that. So oscopy means a lighted lens. Depending upon where they're looking with the lighted lens, then it's arthroscopy, that's looking in a joint. Bronchoscopy, they're looking in the lungs. Colonoscopy, they're looking in the colon. So anyway, cystoscopy, looking in the bladder. So laparoscopy, everybody knows what that is. So watch that video. It'll make more sense to you, but just know this the rest of the semester and the rest of your nursing career. If it ends in oscopy, they're looking with a lighted lens at whatever structure they're trying to look at. So here's a question for you. So your patient has had diarrhea 7 times in the past 4. You don't need to do this, poll everywhere. But I do want you to look at the question. Your patient's had diarrhea 7 times in the past 4 hours. What lab result would you expect as a result of the diarrhea? A hemoglobin of 12, a potassium of 3.2, a glucose of 110, or a BUN of 10? Let's break them down. What is a hemoglobin of 12? Is that normal or abnormal? All right. It's normal. And hemoglobin typically wouldn't be affected by diarrhea unless it's bloody diarrhea. Okay, what about a potassium of 3.2? What's normal potassium? Our potassium is low. 3.2 is too low. The patient has diarrhea. They have pooped out their potassium. So we would expect a potassium of 3.2. Blood glucose is 110. It's okay, right? It's in the normal range. And the BUN is 10. That's in the normal range too. So the answer would be B, potassium of 3.2. Let's do one more. We're preparing our patient for a KUB, and a KUB is a kidneys, ureter, and bladder. So we're looking here at their kidneys, their ureters, and the bladder. Okay, it is a plain x-ray. What should the correct instructions by the nurse? What should be the correct instructions? You cannot eat or drink anything after midnight. Does that matter for a plain x-ray? No. What about you receive IV dye when you're in radiology? No, you're not going to get IV dye with a plain x-ray. With nuclear scans, you're going to get some kind of IV dye, and maybe a CT or whatever, but you're not going to get IV dye with a plain x-ray. You will be sent through a hollow tube for the imaging process. No, not a plain x-ray. That is a CT or an MRI. I need to know if you are pregnant or there's a chance you might be pregnant. Is that important with an x-ray? Absolutely, because radiation is dangerous to a fetus. So that would be the correct answer, D. Okay. And I think that is it. There are your references.